But as an aside, there's this whole notion of laser hair. And these are old statistics, but we all know that in our current society, being hairless is of value to most of your patients. Most of your patients are seeking hair type of treatments, hair removal treatments, that is. And so here's the thing about hair that I hated when I was trying to consider, like, should I or shouldn't I, is that if I got a device that only did laser hair, it was, number one, very, very expensive device, and laser hair, everyone's racing to the bottom, and those are low yield in terms of revenue procedures. So you buy an expensive device for a low yield revenue producing procedure, that's not a good equation, right? And so I'm like, gosh, how do I play this game because everyone's racing to the bottom? And then when I got my first tiptoe into laser hair was because I got an Optimus many, many years ago. And on the Optimus just happened to have hair. And so my Optimus is generating revenues utilizing all the other service lines. And oh yeah, it's got hair on it as well. So that was our first segue into hair because I didn't have to buy a standalone device. So I appreciate so much that this does hair. And it's an easy way to enter into this space because the way I use laser hair mostly, now thankfully we're getting to the point where my estheticians do most of our laser hair treatments, or laser technicians. We're actually pretty busy on that side of the clinic, but before, the best value of being able to offer this service was retention for your patients. What do I mean by that? Your patients are leaving to go get their bikini lines waxed or lased somewhere else, right? They're leaving you to go do that. Everybody's doing it. So if you don't have it, they're leaving you, and it might be likely that whoever they're going to has all the other things that you are also doing. So at first, I really utilized my hair to retain my patients because what I noticed is they were going all over because I didn't offer it. So they were going elsewhere, and I never see them back. So at first, it's a good play for retention of patients. We've got one option that you should consider, and then there's some other specific options which I'll kind of position all on this device. So the one I started with is this diode laser. It's an 810. Which is the gold standard wavelength. It's the most efficient. You got to be careful in 5s and 6s. You can use it, but you just low and slow, because it's the chromophore is melanin. So it sees melanin in the hair bulb, and that's the target, shoots it, and kills the hair follicle.